This is Heal Your Mind, Heal Your Body with Dr. Schuyler. Discover how your thoughts manifest disease and what you can do about it. Here's your host, Dr. Schuyler.
Hello, hello, hello. Welcome back, beautiful souls. We are going over anxiety hacks today for back to school anxiety for your child. And first thing we're going to do is break down what is a panic attack versus an anxiety attack, because they actually are different. So understanding this distinction is critical for learning how to manage it effectively. So while they're very similar, they also differ significantly in terms of onset, symptoms, and duration, and the underlying causes. So, panic attack. A panic attack happens abruptly, often without any obvious trigger. They can occur unexpectedly and they can reach their peak within minutes. And what I have found, panic attacks in my patients mostly happens when they're feeling safe or they're out having a good time. And there's just sudden onset and they cannot understand where it came from. So symptoms are usually very severe and they include rapid heart rate. That's one of the first things you're going to notice. Sweating, trembling or shaking, shortness of breath. Oftentimes it comes with chest pain, nausea, dizziness, this feeling of unreality. It's called derealization, depersonalization, and it means that you feel like you are detached from your own body, as if you stepped out of it and you're having this out of body experience. And it gets this fear of losing control, like you're going crazy, and it often can be accompanied with a fear of dying. And these symptoms become so intense, they are very often mistaken for a heart attack or other serious medical conditions. So panic attacks are short and brief in duration. They last between 5 and 20 minutes, but their after effects, the utter exhaustion and fatigue, can linger longer. The symptoms of a panic attack are more physical in nature and can be extremely intense. So they're associated with the automatic nervous system, their response in charge of the fight or flight response, the activation of it. So while they can occur without warning, certain situations or environments that previously triggered an attack can increase the likelihood of future episodes. Let's say your child had panic attacks at school last year. I'm at the same school. Their body and their mind have memorized a panic attack in that certain area. So sometimes just even pulling up can elicit the memory in another panic attack. So an anxiety attack, it's typically a gradual onset. They build up gradually in response to our own automatic negative thoughts or perceived stressors, and they develop over a period of time. And the symptoms are milder than a panic attack. They're excessive worrying or fear, the sense of restlessness or feeling on edge. And it kind of feels like you're crawling within your own skin. Something's crawling out of you within your own skin. This muscle tension, fatigue, hard time concentrating, irritable, and can't sleep at night. So these symptoms are distressing, but they're generally not as overwhelming as experienced during a panic attack. And anxiety attacks actually last longer. They can go from minutes to hours, and in some cases, days. So the mental focus of anxiety attack, they're more cognitive and emotional. So think of panic attacks as physical, but anxiety attacks more as mental and emotional. And it's characterized by excessive worrying, mind-based, and fear about the potential future or events or stressors. So think anxiety is more cognitive and panic's more somatic, more body. So anxiety attacks often involve these negative thoughts, these automatic negative thoughts that we've talked about. We have upwards of 50,000 negative thoughts a day, and these worries that perpetuate the fear of anxiety. Like these ants feed anxiety, and anxiety is a somatic manifestation of our ants. It's this interplay between physical symptoms and emotions. So common triggers are work, school, relationships. So right now, as your child's having these back to school anxieties or fears, you may be seeing more prevalent anxiety attacks or even panic attacks. So to summarize it, panic attacks are sudden and unexpected, intense and physical. They usually last shorter than 20 minutes and they occur without a clear trigger. It's a panic disorder. Anxiety attack is gradual. It's in response to most of the time automatic negative thoughts. They're milder, they're more about cognition and thoughts. They're longer, they can last hours and days, and it's a perpetual chronic worrying about the future, and it's linked to a specific stressor, whereas panic attack has no clear trigger. All right, so what to do about it? I'm going to name some basic well-known ones, and I'm going to get to not so well-known ones. Deep breathing. Everyone says deep breathing. Fine, great. But here are some real-world hacks. You inhale 4 and exhale 8, and I recommend kids take to school with them, if they're permitted, a straw. So what's happening during the breathing is we're hyperventilating, and this exacerbates the symptoms. And it's really hard to get someone in a panic attack to slow their breath down. It's actually very hard. Anxiety is easier, but a panic attack, it's hard. But if you have the child put a straw in their mouth, that forces someone to slow their breathing down. So what you do is you inhale for 4 and you exhale twice as long as the inhale. And if your mind is counting or even counting backwards, you're switching into a logic state and you can start thinking better and thinking clearer and make better decisions. So deep breathing, inhale 4, exhale 8. I love it when kids can pick out their own straws, and there's some really cute ones on Amazon that you can get, and they get to pick out their colors and, different shapes. But what I have found is that when the child picks out their own straw, they feel a sense of control during their anxiety or panic attack, and they're reusable. Diaphragmatic breathing. So a lot of people talk about this, and it's simply belly breathing, and a good way to understand what the difference is, if you place one hand on your chest and the other hand around your belly button area, and you breathe in so deeply with your nose, only thing should move is your abdomen, not your chest. And I like to think of it this way, and I teach this to kids all the time, is you lay down and put a stuffy on your belly, and you lay flat on your back, and you put the stuffy on the belly, and you imagine pushing the stuffed animal up to the ceiling, and it's like you're pushing it out. And then you drop the stuffed animal down as if you're dropping your belly button to your spine. And if you practice teaching them, I call stuffy breathing, stuffed animal breathing. If you teach them how to inhale, push stuffy up to the ceiling, inhale for 4 and exhale for 8. Now lower stuffy really, really slow. Count 8, 7, 6. If you teach them this prior to the attacks, they have a better odds of using it. And I've had some kids literally carry their stuffy in their backpack because we programmed during times when they feel good and they're happy and they want the tools, that this certain stuffy, their favorite stuffy that can go anywhere they travel, is now related to a positive emotion, a positive experience. And some kids have even gone as far to spray like lavender scent on there so they can smell the stuffy, put the stuffy on their stomach, or just grab it in their backpack, go to the restroom, remind themselves that they're calm. But the distinction is diaphragmatic breathing. If you chest breathe, like you're running, is very different than a belly breath. If you chest breathe, that's going to ignite the fight or flight response. Again, a straw. Love a straw. And we'll get into in a second, you can even get a little kit, this wellness kit, this little bag you're going to keep these little goodies in. So far right now you have a straw in there and you can have a little stuffy in there. Or another thing is you take part of their favorite blanket. I did this with both my kids when they were little, and I cut a section of this felt blanket and I put their favorite scent on there, and they actually put this little piece of cloth in their pocket. And it was this emotional sense of anchor, this sense of safety. They could rub it in their pocket, no one would really notice. They could smell it when they needed to kind of feel calm and safe. Grounding techniques. Everyone talks about grounding techniques. These are ones that I hacked that I found are my favorite. Find 3 things in the room that you've never noticed before. Like really search the room and find 3 obscure things that you have never noticed before. That is one of my favorite things that I have found it works really, really well. Some people use something called 5, 4, 3, 2, 1. Sometimes I find that during real world panic attacks, that's sometimes difficult to keep track of what's 5, what's 4, what's 3. So for me, I prefer finding 3 obscure things you have never, ever noticed before, and you'll be surprised how much your body starts to calm down because you switch to more of a problem-solving brain and out of anxiety limbic brain. Another thing is 333, 3 things you can smell, 3 things you can touch, and 3 body parts. And my favorite body part to tell people to focus on is try to find your second toe, the toe next to your big toe. Take a second and try to feel your second toe in on your right side and try just to move it. Now try to go to your left toe, second toe in. It takes a lot of effort to think about the second toe in. You're switching out limbic brain and getting more into a problem-solving brain. Something to teach your kid as you're teaching them this stuffy belly breath is to remind themselves to say, I'm safe, this is passing. I'm safe, this is passing. My all-time favorite is ice water exposure. This is such a quick hack for managing panic attacks and anxiety attacks. So it's the shock factor. The shock factor of this cold sensation can act to stop and disrupt a panic attack. It jolts the automatic nervous system out of fight or flight. And the cold water triggers this mammalian dive reflex that think of like dolphins, where it reduces the heart rate and conserves oxygen and it promotes this calming effect on the body. So something you can do is splash cold water on your face. I often tell my patients to take an ice bath. Here's my saying, in order to feel better, you have to do better. It's forcing yourself to do the things you do not feel like doing in order to feel the way you want to feel. If you don't want to do an ice bath, you can put your face in cold water, like a salad bowl with some ice and some water. Or you can hold your hands in cold water or put an ice pack on your neck in the front and in the back. The front is going to stimulate the vagus nerve, and the back is going to start changing your breath work and the way your heart is working during the panic attack. So there's so many studies on how cold exposure activates the vagus nerve, which plays a critical role in regulating the parasympathetic nervous system. Basically, ice makes you calm. It shocks the system. All-time favorite tool is to use ice. I've had some kids work with the nurses before where they take a bowl to the nurse's office, and when they feel a panic attack, the nurse puts some ice in there and they put their face in there. It's part of their IEP or their plan, their school plan, to help them work through panic attacks and anxiety attacks. Another one is sour candy. So this intense, sharp taste, Warhead candy is one of them, lemon drops, Red Hots. This sour candy can serve as a powerful sensory distraction, and it shifts their focus away from the panic attack. So, sour candy stimulates the saliva production and frequent swallowing, which regulates the breathing and it stops hyperventilation. And it really, really distracts them. There's something else you can do if you feel one happening, a panic attack happening, is, Warhead candy. I always tell people to get that. You can take a little bite of wasabi or horseradish if you dare. I don't necessarily recommend giving this to a child, but as an adult, if you want to try a little horseradish, that will instantly get rid of your panic attack. Chewing gum. Another one is chewing gum. And I like people to get mint gum. Get mint gum and then drink some water afterward. Ever done that? It burns the mouth, doesn't it? Takes you out of the panic attack. Vicks Vapor Rub. If you get a little kit they can take to school, I like to put a straw in there, a little bit of Warhead candy or Red Hots, and then also a little tube of Vicks Vapor Rub, if they're allowed to have it, obviously, at a certain age. But Vicks Vapor Rub serves also as a way of distracting the mind, focusing on the scent. You can combine almost any of these. So combining ice water exposure with sour candy is multifaceted, and it's completely going to halt the panic attack. Both methods are pretty portable. They can be used discreetly. You can use it at school or in public places. You can take ice from a restaurant and go into the restroom and put it on the back of your neck, put it on your forehead. You can take a straw anywhere. So in this emergency kit, you can have a frozen water bottle that you can use later on, sour candies or mint gum. You can have a straw in there and Vicks Vapor Rub. Now, these are all practical techniques, including they're stuffy. But remember, no matter where you are, you always have your breath. So your breath is always with you. You don't have to pack a certain kit with it. It's something that when you bring awareness to the 3 things that are around you, you don't have to pack that either. Bringing awareness to 3 things you never noticed before. Putting your hand on your belly and just imagine pushing the belly out and then dropping the belly. These are practical, sensory-based interventions that you can gain almost immediate relief from it. And what I like about these tools, and your child can help you, is putting these kits together, having them pick out a cute little bag to put it in, or a cool bag that a boy wants to put it in, having them pick out their straws, getting a little Vicks Vapor Rub to put in there, even just putting a Ziploc baggie in there. So if they're in public and they need to get ice, let's say at a restaurant, you already have a Ziploc baggie to put the ice in, or carrying your frozen water ball around. It's ways that you can create this teamwork with your child, how to come up with ways where they feel empowered, they feel in control. And if you remember last session's also the use of your words, or last episode, also the use of your words. Another one that you can do is closing one eye. Closing one eye can manage a panic attack because it leverages sensory disruption, which interrupts a panic cycle. So our brain processes visual information from both eyes in this cohesive manner. When one eye is closed, it disrupts your perception and your focus, and it reduces sensory overload. So if you start to feel a panic attack and you close one eye or cover one eye, you will notice that this will start to slow down the breath and slow down your sensory perception. You can also integrate this into the breathing technique with the straw or even the Vicks Vapor Rub. So, what I like about these tools, when you practice them at home during an environment they feel safe, they feel good, listening to some music in the background, you practice the belly breath, you practice the straw breathing, you practice the 3 things you haven't seen before, practice feeling the second toe in. It creates this kind of fun, hey, this is how I'm going to empower you because I know that you got this. I know that you will learn this. I know you can do this. So incorporate last podcast episode with these real world hacks and this empowering language. Using this toolkit, this, mint gum, water, sour candy, breath, close one eye, ice pack or a Ziploc baggie they can get ice from, this preparatory kit, they don't feel so out of control. It's okay. I have got a real world hack that I can get through this. And it reminds them that they can do this and this is temporary. And, having 2 teenage daughters myself and working with so many, I know back to school anxiety is real. And I really hope that these tools are applicable and you guys use them and see a real big difference. And hopefully this time next year, your child will not have anxiety attacks or panic attacks. You can learn more about all this on the website. You'll see on the website, I've got free downloads and tips and more information about the upcoming book, but you can get downloads on back to school tips and ideas at drsky.net. And I appreciate you all listening and abundant blessings for the back to the school year and healing vibes your way. Thank you for your time. I feel so grateful you have listened to the end. When we begin to understand how our body manifests stress, trauma, depression, anxiety, and even unexpressed emotions, we then create a space, a bandwidth in our minds to begin to heal our bodies. Healing is a decision, and I am grateful for yours. Abundant blessings, Dr. Schuyler.
To learn more about the work Dr. Schuyler is doing, please visit drschuyler.net. That's drschuyler.net. And remember to subscribe to this podcast wherever you like to listen.
Produced by Audavita Studios. Connect your voice to the world.